totally over-medicated. It was so fast, the weight gain. You think of putting a stone on a month. Can you imagine what that's like? It's heartbreaking. Heartbreaking for Holly to see, heartbreaking for us to see. And you just worry about the medical implications of it as well.
Holly's drastic weight gain was a side effect of the medication. It was part of her mental health treatment. But staff at the unit where Holly was held didn't know how to deal with her autism.
They were quite rough. They would grab you. You'd have, in my first unit, you'd be on the floor, either on the mattress or on the floor, the hard floor, and you have one person on one leg, one person on the other leg, one person on your arm, one person on the other arm, someone on your head.
Holly's condition means she doesn't like to be touched. Pinning her to the ground would only increase her anxiety. On one occasion, she was restrained for nearly 4 hours.
It doesn't really help you learn to cope, because you're just having someone physically stop you for the time being. And there's not someone telling you your therapies, coping strategies.
Her mother Emma told me she felt helpless watching her daughter's condition deteriorate.
Heartbroken is the word, really. Nobody wants someone to lay hands on your kid at all. You know, you think if I was there, I'd stop them, because she was only being herself.
Holly and Emma say the staff at the unit were poorly trained and simply couldn't cope with people with autism. It's a recurring criticism of what's been described as a broken system. Yesterday on Sky News, we reported on the case of Bethany, an autistic teenager locked up for 24 hours a day in solitary confinement. She's just one of more than 2,000 people with a learning disability or autism currently being held in a secure unit in England. Of these, 235 are under the age of 18. Tomorrow, the Joint Committee on Human Rights will publish a damning report on the detention of young people with learning disabilities and/or autism. Their evidence will point to a failure to protect our most vulnerable young people. Holly says she feels much better now, but she wants people to know what really happens inside these units.
I'm feeling more free to be part of this and to have someone hear what I had to say.
We would move heaven and earth to stop it happening again. We would never ask for that sort of help ever again. We'd work ourselves into the ground if Holly was really low again, to that point where we needed help. I don't think we'd ask.
Ashish Joshi, Sky News.